Hello everyone, welcome back. Today we'll be discussing about Parkinson's disease. It is a degenerative disease occurs due to degeneration of dopamine producing cells in the substantia nigra, a nuclei in extrapyramidal system of midbrain, which result in dopamine deficiency. Clear? We have already studied in midbrain part that there one cell is present that is called substantia nigra, which is secreting dopamine, right? So in Parkinson disease that cell is compromised. That's why this will result in dopamine deficiency. Clear? Dopamine plays a role in sensory filtering, inhibit excitatory impulses. Okay, so Parkinson's disease occurs due to dysfunction of extrapyramidal tract. Most often develops in the age of 60s. So the patient who are 60 years old or more, generally they are developing this disease. Now come to etiology part. Exact cause is unknown, but some toxic environmental chemicals such as pesticides and carbon monoxides are suspected contributing factors. Okay, exact cause is unknown to all of us, that how and why Parkinson disease is developing, but basically we can assume that some toxic environmental chemicals such as pesticides, carbon monoxides and all other some toxic things, they are contributing factors. Now family history, clinical manifestation. See, three cardinal features are tremor, pill rolling, that is rigidity, that is stiffness, and bradykinesia, abnormal slow movement. So all these three cardinal features they ask in question also, so you have to understand, that is tremor, that is also called pill rolling, rigidity, that is stiffness, and bradykinesia, abnormal slow movement. So mask like face, that is blank facial expression, and drooling. Clear? This is also very important. All the clinical manifestation of Parkinson disease they ask in exam many times, so you have to give extra attention to these points. Then akinesia, loss of control of voluntary muscle movement. Then monotonous speech, loss of coordination and balance, shuffling steps and propulsive gait. Handwriting becomes progressively smaller. So I am telling you with the example. Can you see that man? See, mask like face. So you will be seeing the patient with a blank expression. Clear? And akinesia, what is that? That patient cannot move the voluntary muscles, means hand, feet, like that, right? You and I can move it easily, right? But those patients with Parkinson disease cannot move voluntary muscles easily. Then monotonous speech, that patient will be irritated sometimes because their voice will be so low and so matlab one rhythm. See, when I am talking to you guys or I am reading all this, my voice is sometimes it's up, sometimes it's down, but for those patients now, that sound or speech will be monotonous, all will be in same scale. Okay, then loss of coordination and balance. Then shuffling steps, what is that? That one step will be like this, like this. मतलब क्या है, ये मान लो ये तुम्हारा अपर ये है, ये तुम्हारा ये है, मतलब शफलिंग गेट में क्या होता है ना, मतलब प्रोपल्सिव क्या है, मतलब वो चाहते हैं, मतलब तुम और मैं क्या करती हूँ कि जब हम जाते हैं ना, क्या हमें इधर स्टॉप करना है तो हम स्टॉप हो जाते हैं, लेकिन वो पेशेंट क्या होगा ना, वो खुद को कंट्रोल नहीं कर पाएंगे, मतलब वो रुकना चाहते हैं लेकिन वो रुक नहीं पाएंगे. बेसिकली दैट मीन्स shuffling steps and propulsive gait. Handwriting becomes progressively smaller. Hope it is clear. Now those fast things are also same. Tremor means pill rolling. Matlab if you start to roll your thumb and index finger, you can also do by yourself. Rigidity means stiffness will be there. Then bradykinesia means abnormal slow movement. They cannot go, matlab either they will go very slow, or sometimes they won't be able to control their speed. So both will be seen in Parkinson disease. Hope it is clear to all of you. I am giving extra pressure on this clinical manifestation because it is very important. Okay, now management part, let's see. Provide small, frequent, high calorie, protein, fiber and soft diet. Okay, encourage client to lift feet when walking and to avoid prolonged sitting. So we have to tell the patient to lift feet when walking and avoid prolonged sitting. If patient is sitting for a long time, we should not encourage that. Okay, and we have to tell the patient you lift your feet because they used to shuffle. मतलब क्या है, मतलब बिल्कुल हमारा जो गैप होता है नॉर्मल, जब हम एक पैर उठाते एक पैर ये करते हैं ना, उसका जो हाइट होता है वो पार्किंसन में वो और भी कम हो जाता है, इसलिए उसको हमें एनकरेज करना है. नाउ एडमिनिस्टर एंटी पार्किंसनियन मेडिकेशन, दैट इज दिस ड्रग्स रिस्टोर द बैलेंस बिटवीन न्यूरोट्रांसमीटर्स लाइक एसिटाइलकोलिन एंड डोपामिन इन द CNS. It includes dopaminergic, anticholinergic and catecholamine transferase inhibitor. Okay. Now dopaminergic medication stimulates the dopamine receptors in the CNS and increase level of dopamine. Example is amantadine. What is that? An antiviral agent also used to treat Parkinson's disease. Then bromocriptine, that is also used to suppress lactation or hyperprolactinemia, carbidopa, levodopa, etc. In pediatric class, we have already studied in breastfeeding class that what is the role of bromocriptine. It is used for those mother whose baby has been passed away to suppress the lactation. Clear? If you have not watched, if you want to, then you can also watch that clip. Now, because dopamine itself cannot cross the blood-brain barrier, that is BBB, so combination of carbidopa and levodopa is used, because in that case the side effects will be more. Okay, and carbidopa prevents destruction of levodopa, so a precursor of dopamine by liver. Clear? Advised to avoid food rich in vitamin B6 because it blocks the effect of Parkinson's medication. So we should not give food which is rich in vitamin B6, that is pyridoxine, because it blocks the effect of anti-Parkinson's medication. Clear? Then avoid use of carbidopa, levodopa along with antidepressants like monoamine oxidase inhibitor, MAO inhibitor, that is because MAO inhibitor will precipitate hypertensive crisis. So those drug interaction also you have to remember. So let's see management part once again. We have to give small, frequent, high calorie, protein, fiber and soft diet to the patient. Okay, now we have to encourage the client to lift feet when walking and avoid prolonged sitting. And also we have to tell those patients to not to sit in sun, because that is also asked in exam many times, that if a patient is sitting in sun for a long time who is having Parkinson disease, so then the option will be like that. Then one option will be like you should not encourage the patient to sit in sun, so that will be the correct answer. So I am telling you from the previous year question papers. Okay, now coming to next point, that is administered anti-Parkinsonian medication, that is these drugs restore the balance between neurotransmitter like acetylcholine and dopamine in the CNS. Okay, now it includes dopaminergic, anticholinergic and catechol-O-methyl transferase inhibitor. It includes dopaminergic, anticholinergic and catechol-O-methyl transferase inhibitor. And dopaminergic medication stimulates dopamine receptors in the CNS and increase level of dopamine. Example is amantadine or amantadine. An antiviral agent that is also used to treat Parkinson's disease. Then bromocriptine we are using, and carbidopa, levodopa, etc. Okay, because dopamine itself cannot cross the blood-brain barrier. So combination of carbidopa and levodopa is used. Carbidopa prevents destruction of levodopa, a precursor of dopamine by liver. Advised to avoid food rich in vitamin B6 because it will be blocked the effect of anti-Parkinson's medication. Avoid use of carbidopa, levodopa along with antidepressants like monoamine oxidase inhibitor because MAO inhibitor will precipitate hypertensive crisis. Hope it is clear to all of you. Keep studying, keep learning, and thank you so much for hearing me.